Now, these were the conditions at rest. What happens during exercise? Well, during exercise, our metabolism is ramped up, right? So we are using more oxygen to make more ATP to make our muscles move. So, meaning that if we use more oxygen, our partial pressure of oxygen in the muscle will be reduced. So instead of a PO2 of 40 millimeters mercury, I'm going to put this in orange down here, our partial pressure of oxygen now could be down to, let's call it 10 millimeters of mercury. Because we used more oxygen to make ATP. Now in the systemic capillary, our partial pressure of oxygen is still pretty high. It's still around 100. And in fact, during exercise, it could be even higher, let's say 110 millimeters of mercury. That makes that driving force even greater for oxygen to diffuse from the bloodstream into the muscle fiber. Right? We're now going from 100 millimeters of mercury down to 10. So we have a driving pressure of 90 millimeters of mercury. So we have even more oxygen wanting to come into the muscle. And that's a great thing, right? Because then we're replenishing our muscle, we're replenishing oxygen in the muscle so we can use more to make more ATP. That's exactly what we want to do. Now, all of that will also produce more carbon dioxide. We're going to talk about bioenergetics in a little bit later, but when we ramp up our metabolism, we use more oxygen, we're also creating more carbon dioxide. So carbon dioxide pressure in the muscle will also be a little bit higher. Let's call it a little bit higher, 48 maybe millimeters of mercury. The PCO2 that is coming in the bloodstream is still 40. So we have, again, higher driving pressure for carbon dioxide to want to diffuse out from the muscle into the systemic capillary so they can breathe it out. So the PO2 here coming out of the systemic capillary, instead of 40, we have 10 here, and instead of 46, we have about 48. So slight changes, especially with oxygen. The partial pressure of oxygen is much greater than the changes in carbon dioxide. But the whole point is to get more oxygen down to the muscle where it's actually needed, and carbon dioxide out of the muscle to be breathed out again.
So in summary of gas exchange, gases of interest are oxygen and carbon dioxide. They will diffuse between alveoli and pulmonary capillaries in the lungs, and between systemic capillaries and the muscle fibers in the tissues. They move via simple passive diffusion down their pressure gradient, and changes during exercise mainly is a lower PO2 in the muscle fiber as that oxygen is being used to make ATP, and that will increase the driving force, the pressure difference for oxygen to diffuse from the systemic capillaries into the muscle